Welcome back to my channel. And if you're new, welcome to my channel. My name is Nikki, and this is my millionth time trying to record this, and I'm ready to rip my hair out. It is late. I should be in bed. It's been a long day. I have work in the morning, but I wanted to hop on here really quick just because I feel like I'm going to keep pushing it off until it's too late and it's last minute, and I wanted to give everybody an update that has been watching me. I know that I have a small following, but y'all are important, and I want to be able to fill you in about what's been going on with me, how I'm feeling, and what's about to be happening. So I'm going to try to make this as short as I possibly can because I've already recorded this once and it took around like a half an hour, and I just hated the way that it came out, and I am not good at editing. So it's once again going to be raw, uncut, just kind of scatterbrain because I'm a scatterbrain person. I have the operative report. I have something else that I'm going to explain later, but I'm going to try to just shoot through this as quickly as I can without rambling like I did in my last video that I just recorded, that I just wasted all of that because I wanted to sit there and ramble. So, I had my surgery February 25th by Dr. Tao at University Hospital in Cleveland, and I woke up from surgery in a pretty significant amount of pain and feeling like there was something wrong the second that I woke up. And I had expressed this to him, and he just basically stated, it's going to be painful. You're going to have to give it time. It's going to take months. So I went home and I did record, I guess, a quote unquote like mini vlog of like the first, it was like 10 or 12 days that after my surgery. So, I mean, that video is on this channel too. But I guess around like month 2.5, I kind of had hit just a roadblock because I felt like my pain was not getting better. It was actually getting worse. And at that point in time, I felt like I needed to get a second opinion. So I had called Dr. Tao's office to get my medical records because I had made an appointment with Dr. Hansen, which was on May 5th because I remember it was Cinco de Mayo. And I made an appointment with him because I wanted to get the second opinion due to the fact that I was just in so much pain and it didn't make sense to me. And I kept telling Dr. Tao that, and he just kept telling me that I was overly sensitive to pain and that it was going to take more time, which, like, I do understand that. I do believe that it takes time for things to heal, but things should not have been getting worse the way that they were, in my own opinion. That's why I felt like I needed the second opinion. So I called their office, I called the receptionist, I asked for my medical records because I had the hardest time. When I tell you the hardest time getting my medical records from this hospital, I've never had issues getting medical records. And I felt like something was extremely shady with getting these medical records because as soon as I had called the office and expressed that I wanted my medical records, and the receptionist asked where I was going, if they could fax them anywhere, and I just said I was going to Dr. Hansen, and she said, well, you need to fill out a release and fax it back to me, blase, blase. I had already filled multiple release forms out at this point in time and faxed them to the medical department or the medical records department, and they had not sent me anything. I had not heard from them. I couldn't get a hold of them through calling them, nothing. So I called her to try to get them, and she said that I just needed to call down to them. I got irritated, so I hung up. And within like the next half hour, I received a call from Dr. Tao, and he was just like in a shamble. And it was extremely alarming to me because out of nowhere, it kind of turned into like a, hey, I'm just calling because I wanted to check in and see how you were feeling. I was concerned about you and I was worried about your pain levels and wanted to just see how you were, your pain levels are. And I'm just sitting there thinking, like, I've called you over the last 2 months telling you how much pain I was in, and now you are concerned about my pain. So I thought it was kind of strange that, like, it was literally a half hour after I had called their office. So he had called me basically to state that he had tied or sutured, I keep saying tied, but he had sutured my 11th ribs to my 10th ribs on both sides, which basically, because the 11th ribs are considered floating, I'm pretty sure. I'm sorry if I'm wrong. I think they're floating. They're not supposed to be sutured to anything. I do know that much. The 11th and the 12th ribs are not supposed to be sutured to anything. So I ended up getting that response from him. And on top of that, he had stated to me that he had tied me extremely tightly and that he thinks he tied me so tight that he was basically crushing my nerves in my torso. So, stating that to me, I was so angry at him because I feel like for this whole time that I had been calling and stating that I was in pain, and he was sitting there telling me I was, oversensitive to pain and whatever. He was making me sound like I was crazy for him to be admitting that he was doing something wrong. And for a surgeon to admit that they had done something wrong is a huge thing, because normally surgeons and doctors don't admit when they're wrong, as bad as that sounds, but I've heard that from other surgeons and doctors. But it was a huge thing for him to admit that. So I'll give him that much credit, but other than that, the only reason that he did it is because he knew that I was going to see Dr. Hansen as a second opinion, as far as I'm concerned. And I know that they had just been at a conference discussing the Hansen Technique 3.0. I had the 2.0, but they had been learning the 3.0. And he was there. He ended up leaving before they had even, shown how to do the procedure. But Dr. Tao had stated to me that he had spoken with Dr. Hansen about my case, which I ended up asking Dr. Hansen at my appointment whether he had spoken with Dr. Tao, and he said that he did, and that Dr. Tao had brought up wanting to speak with him about a case, but not mine. So that was lie number one. So what other things he was lying about, I don't know, but he did talk to Dr. Hansen. He just never came back and talked to him about whose case he wanted to talk about. But he said to me that he had talked to Dr. Hansen about my case personally. So either way, I have the operative report here. I'm not going to read the whole thing, but it does say that he made the incisions, and it says the patient had a classic slipped rib anatomy with slipping of the 10th rib relative to the 9th. The 9th appeared normal. The 11th rib also had somewhat unusual shape / conformation, whereby the costal cartilage appeared to protrude inward towards her peritoneal cavity. I felt it was reasonable to stabilize 10 to 9 and also 11 to 10. I used a series of figure 8 suture tape stitches to stabilize 10 to 9 and then again 11 to 10. In conclusion of this, I was quite satisfied that the ribs were appropriately stabilized and would not sublux in a painful way. So, knowing now that he had sutured my 11th to my 10th, I was even more furious going into this appointment with Dr. Hansen. But I didn't know any of this until I had the appointment with Dr. Hansen, because he was able to get the records way easier than I was able to and read the operative report to me. But then Dr. Hansen performed the physical exam, and he actually discovered that my 11th ribs were not sutured to anything. They were actually freely floating as they should be. So basically, Dr. Tao, what he had done was miscounted my ribs, which Dr. Hansen said can be pretty common, especially in people with cases like mine, because my 12th ribs on the CT scan show that they were probably about this long, whereas like normal 12th ribs, I want to say, like looking at a CT or an x-ray, are probably about this long, so mine are much shorter. So he said that he thinks that Dr. Tao miscounted my ribs and was actually tying my 10th to my 9th and my 9th to my 8th instead of tying my 11th. And I mean suturing. If I say tying, I mean suturing. It is what comes to mind easier, I guess. So he told me that my 11s were not sutured to anything, but stated that I did still have, tightness. So like just he could feel how tight everything else was, and just I was super sensitive to touch to my ribs, which I was still pretty, fresh out of surgery. Like I don't want to say that I was like at full recovery, because I'm not. They said to at least wait 6 months until you can kind of determine whether the surgery was successful or not. But mine was just so severe. Like the pain was so severe that I have pretty much been bedridden, other than dragging myself out of my bed to perform my job, because I have to. I don't have a choice at this point. So basically, I saw Dr. Hansen. He had told me that he was scheduling surgery clear out in January of 2023, and that I was more than welcome to be, have surgery performed by him. But if I wanted to get in with somebody else sooner, that I could look, at my other options and what I had. Now, as far as going back to Dr. Tao had left multiple voicemails trying to set up surgery to correct the problem, or even perform the Hansen Technique 3.0, which if you're not even going to stay at the conference long enough to learn the procedure, do you think I'm going to trust you touching my body on something you already screwed up a second time on a procedure that you didn't even stay to watch? So the fact that he didn't do that, on top of like wanting to go back in and fix what you screwed up, I didn't trust him doing that. So that wasn't really an option for me, because it just didn't sit well with me. So I started looking elsewhere. I'm in the Facebook group for slipping rib syndrome. So I've seen a lot of people talk about Dr. Erickson down in South Carolina, and have said great things about him, and their recoveries have been going really well. So he was somebody that I looked into, and I made an appointment with him on May 18th. So I had the appointment with Dr. Hansen May 5th. I had the appointment with Dr. Erickson. I got in with him pretty quickly. So I had to make flight reservations and Airbnb reservations pretty quickly, and was able to get time off with my job pretty easily. They were pretty lenient about it. So I flew down the 17th, and I had my appointment the 18th with Dr. Erickson, and he had stated as well when he did my physical examination that my 11th ribs were not sutured to anything, and that they were freely floating. So that was clarified by 2 surgeons that know what they're doing, that they are not attached to anything, which benefited Dr. Tao, because he actually thought he did something wrong and didn't do anything wrong other than suturing me entirely too tightly, which is still like a problem in itself when you admit that you tied me too tightly, which I feel like if you're trained in the procedure properly, that you would know not to tie somebody too tight, or like why you would tie somebody so tightly, knowing that you did that and not saying anything. It still blows my mind just sitting here thinking about it, that he would have just like let me live my life in pain and not have ever said anything, hadn't I said that I was going to get a second opinion elsewhere. So going to Dr. Erickson, he had basically looked at my CT scan that I had prior to any surgery. So this was, pre-op Nikki's ribs. And he was looking at it and said that he thought that I could benefit from redoing the 2.0. We did discuss doing the 3.0, but we wanted to save that for kind of like the last option, just because once you cut out cartilage, you don't get the cartilage back. So it's kind of like a last resort for me as far as the 3.0 goes. So we had discussed taking all of the sutures that I have out now, and he was going to resuture my 10th ribs to my 9th to my 8th, and then as well as trimming down the cartilage on my 8th ribs, because it is the ends of them are quite pointy and long, like just sticking out way more than they should be. So I don't know how mobile those tips are. I'm not sure whether he stated that he was just going to suture the 9th to the 8th, or whether he was going to put a suture between the 9ths and the 8ths, just because of the tips of my 8ths being so mobile, that he wanted to just put some extra, I guess, backup as far as suturing that, to kind of like hold the 8ths from breaking away from the 7ths, just so that in case I have any trauma or anything in the future, that they're less likely to break away from the other cartilage, if any of that makes sense. I don't know whether I'm even getting it correctly, so don't quote me on it. I'm not really going to fully know what is done, obviously, until after I have the surgery done. But I also found out that I have a lot of pain in my breastbone area, and it pops quite often. And he told me that he thinks that I have Ehlers or hypermobile Ehlers-Danlos. I've not been diagnosed with it, but I've been to 4 rheumatologists that have all told me that I'm hypermobile. And Dr. Hansen also asked me if I've ever been diagnosed with it. And then Dr. Erickson also asked me if I've ever been diagnosed with hypermobile EDS. So I think that I have it. It also runs in my family, so that's why I think that I do. But he said an option always is to put a chest plate in, because this joint, there's just too much space and it will pop when there's too much space in between a joint. It's like the same thing as popping our fingers. It's just the air gets in between, and that's what causes the popping. But he could always put a plate there to prevent that popping, but he has never plated somebody that's hypermobile, so he doesn't know how much it's going to benefit somebody that's hypermobile. It could always go in there and just not work, or it could go in there and your body just reject it, whatever the case may be. I'm getting up there in time on this video, so I'm trying to speed up my thoughts. So we had set a surgery date for July 29th, which is when my surgery is going to take place, unless there was a cancellation. I don't think there's going to be a cancellation, because I know that Dr. Erickson's going on vacation, I'm pretty sure mid-July or this month, so I don't think there's going to be anything sooner. But the surgery cannot come soon enough because of the amount of pain that I've been in. Basically what I've been dealing with is just very restricted breathing. I feel like everything's kind of been brought down here, like up, and I can't get a full breath in. Like, it's like my lungs aren't fully expanding because it's so tight. Dr. Erickson stated that I still have a mobile tip on my left side, so it means that it was tied too tightly, because it's kind of like sticking out too. Like, I can feel it if I palpate it. So things definitely need to be fixed in there. I'm having issues with sleeping. I've bought 2 mattress toppers, different ones. I've bought a Tempur-Pedic mattress topper and a cheaper one, that they both just suck, and sleeping sucks for me. I've pretty much gone around 3 months or so with barely any sleep. I've been tossing and turning and waking up probably 15 to 20 times in the middle of the night, and I wake up in tears and just debilitating pain every morning. Once I get up and I start moving around a little bit, I seem to, I guess, loosen up a little bit, but it's been really painful, and it's been really hard, and the pain is causing a suppressing appetite as well. So my nutrition has just sucked since I've had surgery. I'm barely eating anything. So I've been feeling even worse that way. So, and I've been basically forcing myself through everything as far as my job goes. My job is, for anybody that's new, I'm a truck driver, which is going to be ending after this second surgery. I'm out of the truck. I'm done. It's just too hard on my body. But I'm doing it right now because I need to maintain my insurance, because I would have switched jobs a long time ago if I didn't have to wait a grace period for an insurance. but I didn't have that option. So I had to go back to work, and I've had to push myself through my job just to be able to maintain that up until I have surgery. So it's been really difficult for me. Sleeping's been difficult. That's probably been the most difficult part. I actually even reached out to pain management, not the opiate route. That wasn't something that I wanted to do. I did have extra pills left over from Dr. Tao that he continued to prescribe me because I was in pain, and he didn't understand why I was in pain. But I tried to stretch those out as much as I could, but I have officially run out. So I don't know what I'm going to do over the next 3 weeks or so as far as pain wise, other than ibuprofen. But I did start going to Pittsburgh, Pennsylvania for a doctor that does regenerative regenerative pain management. So he does things like steroid injections, trigger point injections, which are basically like short-term nerve blocks, I guess. They're very short-lived, but I mean, for that little amount of pain relief is nice. The dry needling, I've had the dry needling done. There's like infusion therapy and a bunch of different things. I've had the red light laser therapy done. And it started to help in the beginning, I feel like, but towards the last couple weeks, I feel like I've been in more pain than what I normally am. So I'm going this Friday, and this Friday is probably going to be the last time that I go, just because I feel like I'm wasting my money. So that's what I've also been trying to do for pain. Other than that, I don't ice a whole lot. With as much as my mom tries to push me to ice, I don't feel like it helps me a whole lot. But I mean, ibuprofen and heat has been pretty much what I've been doing to try to just get myself through it. And sleeping has just been a nightmare. So this surgery can't come soon enough. And the last thing that I wanted to state too, as far as Dr. Tao went, and I don't want to bash Dr. Tao, and I don't want to discredit him, because I do think as a surgeon, as far as like his specialty or his what he does, I'm not discrediting him. As far as specifically the slipping rib syndrome repair goes, I don't know whether I would recommend that as far as him being a surgeon in that area, just because I don't know how he was trained. I don't know whether he was trained properly, how he did it. But I know that I wasn't very high up on the amount of people that he's performed this surgery on, so I don't know whether I would recommend it for that, just because, like I said, I had a bad experience. Doesn't mean everybody else is going to have a bad experience. But as for him being a surgeon, dealing with people in every other area of the lungs and the chest wall and things like that, I'm not discrediting him at all. And I just want to put that as a huge disclaimer, because I'm not bashing anybody, but my experience with him has been absolutely dreadful. And I will not be going back to him, and Dr. Erickson will be taking over my case from this point forward. But I also signed a release form that I had filled out, and this was a video of my surgery that Dr. Tao did, as well as an interview that I had with him. And this was signed before I had surgery, I'm pretty sure. And it was for the release of information, to release my video to the public of my surgery, but it was a surgery that was done incorrectly. So I have asked this media lady that contacted me and reached out for this video and for the interview since I had the surgery, and I have yet to see anything, which is once again extremely shady to me. So I just feel like the whole situation was rather shady and just pretty alarming, as far as somebody that is supposed to, you're trusting them with your body and putting your life in their hands, and for them to do you this dirty is just, it sickens me. It really does. And I don't want it to happen to anybody else. And I feel for anybody else that you know, is going through the same thing, that, you know, is either been messed up or has not been done correctly, and they're dealing with even worse pain than, you know, their pre-op pain, because I would give anything to go back to my pre-op pain over this. Like, it just, my pre-op pain was already, I just spit. My pre-op pain was already probably a 10 out of a 10, and now it's like 100 out of 10. Like, it far surpasses the chart of pain. So, but on that note, I'm going to kind of close out this video because it has been way longer than what I had planned it to be. So, surgery is planned. I will come back on when I'm feeling able-bodied to update again, from the second surgery, and just let people know what he had done, how I'm feeling at that point, and then maybe do like a 6-month update. That's my plan anyway. Things have been really hectic, so it's been hard for me to get on here and feel like, and I just haven't felt like doing it. I've once again been just mentally struggling, so it's been hard to get on here and talk about it, because it's caused huge emotional distress, and it's been a heavy thing to carry for the last, it's been around almost 5 months on the 25th of this month. So it's been quite the experience and quite the journey. So, I guess closing out, I'll just say that, you know, I'm saying a prayer for everybody else that's going through the same thing, and, is either seeking answers, getting surgery, recovering from surgery. You all are in my thoughts. Anybody struggling with this, I highly, highly recommend you be your own self-advocate, just because other doctors are not always willing to put us first and point us in the right direction. So sometimes we have to do our own research to be able to find the right resources. So if anybody needs any type of resources or any just support, I'm here. I'm here to listen. You know, reach out to me, and I'm willing to talk to anybody about either my own situation or my experience, and try to answer whatever questions I can. I'm no medical professional, so I can't answer medical questions as far as diagnosing, obviously. So, but as far as support goes, I'm here for you all. And until the next one, peace and love, guys.